Welcome to the training on occupational health, environment and safety. Let us learn the module on first aid for choking. Before we begin, let's take a look at the key learning objectives. After completing this module, you will be able to define choking and explain how it is caused, recognize and list the signs and symptoms of choking, demonstrate the steps to provide first aid for choking. Choking occurs when a foreign object becomes lodged in the throat or windpipe, blocking the flow of air and causing difficulty in breathing. If not treated immediately, it may even cause death. We should also know that different processes of first aid for choking is given to adults, children, pregnant women or obese people, unconscious people, self. Now let us see what causes choking. Incomplete chewing of food, talking or laughing while eating, alcohol consumption, adults, medical conditions like Parkinson's disease, etc. Young children may also choke on small objects like toys, hard candies, etc. The universal sign of choking is clutching the throat. If you see this, immediately ask the person if he is choking and administer first aid to the person. If you are choking and cannot call for help, show this sign. Other signs or symptoms of choking may include a sudden inability to speak, panic and hand signals, coughing and gagging or wheezing, loss of consciousness. In infants, the signs and symptoms of choking are difficult breathing, weak cough, weak cry. In case you see a person choking, and if he is conscious, immediately deliver 5 back blows. Give 5 abdominal thrusts, which is also called the Heimlich maneuver. If the block still remains, and if the person cannot breathe, repeat and alternate between 5 back blows and 5 abdominal thrusts until the block is dislodged. Step 1. Give 5 back blows. Step 2. Heimlich maneuver. Stand behind the person. Make a fist with one hand. Perform thrusts. Click the images to know more. First, deliver 5 back blows between the person's shoulder blades with the heel of your hand. Stand behind the person. Wrap your arms around the waist. Tip the person forward slightly. Make a fist with one hand. Position it slightly above the person's navel. Perform thrusts. Press hard into the abdomen with a quick upward thrust, as if trying to lift the person up. For pregnant women or obese people, it may not be possible to wrap your hands around their abdomen. Hence do chest thrusts rather than abdominal thrusts. Position your hands a little bit higher than with a normal Heimlich maneuver at the base of the breastbone. Proceed as with the Heimlich maneuver, pressing hard into the chest with a quick thrust. Repeat chest thrusts. For an unconscious person, it may be difficult to lift the person on your own. Hence, the first aid given for choking will be CPR while they are lying down. Lower the person on his or her back onto the floor. Clear the airway. If possible, reach a finger into the mouth and sweep out the cause of the blockage. Begin cardiopulmonary resuscitation, CPR. Never ever use abdominal thrusts on a baby under 1 year. This can cause serious injury. In infants, deliver 5 back blows and deliver 5 chest thrusts. Repeat the back blows and chest thrusts. If the infant still does not breathe, call for emergency medical help. For children above 1 year, use the same process as for adults. Click the images to know more. Back blows. Give up to 5 back blows. Hold the baby's face down along your forearm with their head lower than their bottom. Hit them firmly on their back between the shoulder blades. Chest thrusts. Give up to 5 chest thrusts. Turn the baby over so they are facing upwards and place 2 fingers in the middle of their chest, just below the nipples. Push inwards and upwards up to 5 times. If nobody is around and you are choking, then you can give yourself first aid. Place a fist slightly above your navel. Grasp your fist with the other hand and bend over a hard surface. A countertop or chair will do. Push your fist inward and upward.
Let's now look at the treatment.
Once you have established the casualty is in fact choking, your first action should be to calm and reassure the casualty and encourage them to cough. If this is not successful, then you should stand behind the casualty, lean them slightly forward, supporting their upper chest with either one hand or your arm across their chest, and give sharp back blows between their shoulder blades. These back blows should be attempted on 5 occasions. Check the mouth and remove any obstruction. If your back blows were unsuccessful, then you should attempt to give 5 abdominal thrusts. Again, stand behind the casualty and place both arms around them, leaning the casualty forward. Place one fist just below the breastbone and cup the fist with the other hand, as shown on the video. Then pull sharply inwards and upwards to try and force the obstruction out. Again, you should make 5 attempts with abdominal thrusts to remove the obstruction. If this is unsuccessful, you should repeat the cycle of back blows and abdominal thrusts. And if after 3 cycles the obstruction is not cleared, you should then call 999. If at any time the casualty becomes unresponsive and unconscious, you should support the casualty to the floor, call the emergency services as soon as possible, and commence basic life support.
A choking infant. First of all, is there a way to find out if an infant is choking? Well, we put our hands to the throat. What do babies do? Basically, their eyes open up wide and their hands come up. In other words, they're saying, somebody help me. Well, we have an infant right here that is going to be choking. Here's what we do. Number 1, we will grab their legs and lift up the baby, supporting their head, putting the baby in our hand, supporting their back. Our next step, we've taken our other hand, putting it right between the jaw to avoid them closing their mouth, and we're going to be flipping them to the other side. Our next step would be to sit down and put the victim over your thigh in a 45-degree angle to help assist with gravity. The other hand will go right between the shoulder blades, and we're going to pound 5 times. Our next step would be to grab the infant, flip them to the other hand, bringing them into us, our middle finger between the nipples, the same location we do CPR, and our index below that, 5 chest thrusts, about 1 second each one. We'll take a look inside the victim's mouth to see if we see anything. We do not, and I repeat again, we do not put our fingers inside their mouth to pull an item out unless we can visually see it at the tip of the mouth. And then if we do not see anything, we will flip over and do it again until the item comes out, or God forbid until the infant becomes unresponsive. If they do become unresponsive, we will begin CPR immediately.